I'll be your nurse today, and the doctor ordered a respiratory and cardiovascular assessment today. Is that right?
That's correct.
All right. And do you have any allergies?
No, I do not.
And are you in any cardiovascular or respiratory pain or distress today?
No, I'm not.
Great. And I'm going to wash my hands. And I have provided privacy because the door is shut. And now I'm going to inspect any apical pulsation and note any heaves or lifts. So, can you just take a deep breath for me? And then, great, no heaves or lifts noted. And now I'm going to osculate in a couple different areas. So I'm going to start listening to the aortic. And then I will be doing the pulmonic. Herbs point. Mitral. And tricuspid. S1 and S2 were noted for that. No heart murmurs or irregularities or anything like that. And now, and rhythm is regular. And now I'm going to just have you lay down for me for a second.
Okay.
And no jugular vein distension is present. And then go ahead and sit back up for me. And now I'm going to listen for any breweries. So each time you feel my stethoscope, just go ahead and hold your breath for me, please.
Okay.
Alright, good. And no breweries present. And now I'm going to inspect skin color and symmetry and everything like that. So skin color is appropriate for ethnicity. And I'm going to check for edema. So I'm just going to check on a bone prominence. So I'll just go here. Great, no edema. And now I'm going to check for capillary refill. And it's less than 3 seconds, which is a good finding, all within the limits that it should be. And now I'm going to check radial pulse on both sides. So go ahead and rated 3 equal bilaterally. I'm going to check radial pulse, or brachial pulse equal bilaterally 3. And now I'm going to have you lay down so that I can inspect your lower extremities. So go ahead and lay down and scoot yourself up a little bit.
Okay.
Alright, so skin color is appropriate for ethnicity. Hair distribution is good. Everything looks symmetrical. And now I'm going to palpate for edema on the ankles. And no edema noted, and now I'm going to go through the rest of the pulses. So I'm going to do popliteal, so the back of the knee. Equal bilaterally, strength 3, and then I am going to go to posterior tibialis, which is the back of the ankle, and that is equal bilaterally 3. And dorsalis pedialis, which is on top of the foot, and that is equal bilaterally 3. And I would check for capillary refill, less than 3 seconds. Great, you can go ahead and sit back up now. Thank you. And and then I will, and so I noted all the pulses, and so now I'm moving on to respiratory. So, now I'm moving on to respiratory. So I am just noting and palpating for any crepitus. Great, no crepitus noted, and I am going to listen to the heart sounds on the back. So for this purpose of this assessment, I'm going to have you turn your back towards me, okay?
Okay.
And then I'm going to listen in a zigzag motion to the lung sounds, and each time that you feel my stethoscope down on you, can you just take a breath for me, please?
Okay.
Alright, lung sounds are clear posteriorly bilaterally, and now I'm just going to have you lean forward just a little bit, and then can you take a deep breath for me, please? Equal expansion, and then I'm going to start at T10, and then as I'm going down, hold your breath and say 99 for me, please.
99. 99. 99. 99.
Great, and equal expansion and everything like that. And then moving on, skin color is appropriate for ethnicity, doesn't appear to be using any accessory muscles for respiration, for breathing, and based on his facial expressions, he's not in any respiratory distress. And so now I'm going to move on to listen to the heart sound, or the lung sounds anteriorly. So I will go ahead and do that. And lung sounds are clear anteriorly, bilaterally. So everything looks good, and that concludes our assessment.